Hi patrons of Chiropractical. This quick review is about how to relieve pain in the back part of your hip. This part is also scientifically referred to as the butt. Now when you have pain here in the back side of the glutes, it can also mimic something called sciatica, and that's because it can radiate pain down the leg part way. And it's also called piriformis syndrome or glute strain. So today I'm going to cover with you two things. Number one is a stretch, and number two is how to use a foam roller to loosen up the knots in this area. So with the stretch, what you want to do is lay on your back. You want to bring your knee up over top of your belly button. And then with your other hand, you want to grab your ankle and twist or rotate the thigh inwards. Now it's very important here. Quite often people will see this stretch and they just pull the knee up to the shoulder, across to the other shoulder, but it's the rotation in the thigh that we're after here to hit a different spot. Of course, do move it around a little bit so you can hit that sweet spot, and that'll help stretch out the muscles in the backside. Now number two with the foam roller, basically we're just using a giant rolling pin to help roll out some of the knots in the butt muscles. So you want to sit on the foam roller on the involved side. We're going to cross the leg over, very similar to what we did with the stretch. This just helps lengthen out the muscles. And then you're just going to rock the hips side to side, rolling on the trigger point here, the knot. Now if you find it's really sore, really tender, don't worry about the rolling part. Just put pressure on it and do some pressure points. Now at the stretches, we want to do about 3 of them a day, holding each one for 30 seconds. And with the foam rolling, just 30 seconds on each butt cheek each day should be sufficient.